This is NainaMD, Fusion of Science and Beauty, and I've got a fabulous show today. My first guest, Dr. Helen Kizler. She's a compounding pharmacist and owns a compounding pharmacy, a fabulous one at that, in Santa Monica. Please tell us about your pharmacy, and really what I brought you here today, and so glad you could be here, is I want the audience to know, why is there a compounding pharmacy popping up almost all over? We have the number of compounding pharmacies has increased incredibly. Why the demand? Who's propelling the demand for this?
That's a very good question. In my opinion, the demand is very much driven by incredibly smart, intelligent people. People in our area where the pharmacy is at, where you're at,
yes,
are incredibly intelligent. They're very educated. The questions they ask and the things that they want to put in their bodies.
I know, isn't it amazing the questions they are asked? Yeah.
Yes. It's almost like, wow, and you're just not in medical field? How do you know about this?
Yeah.
So the demand is really truly driven by people. People who use compounded medications just feel wonderful. They love anti-aging approach. They love preventative medicine. They're searching and aiming of feeling healthy and being youthful.
Well, tell me, why is it then that conventional medicine has such a misperception about anti-aging? I understand that the misperception needs to be cleared, because 20 years ago, when we first started, there were mistakes that my mentors or forefathers, you know, that happens with every specialty, right?
Right.
The thought leaders are always attacked and so forth. But why is the misperception in conventional medicine still exists out there? Especially when the demand is exponentially, and this is globally. When I go in and I lecture to doctors internationally, when I was in Bangkok in Asia, Dubai, it's incredible. The term anti-aging and regenerative medicine, but yet why is it here that it's still such a misperception? What do you think? Why is that, you think?
Well, in my opinion, it comes from, initially there is a root of something. For example, if we look at Paleo Diet, Paleo Diet is so much in. So that was something that was happening back in the days before. And right now, we're going away from refined food and away from sugar and away from what is prepared not in a natural way. And we're going back into eating the paleo way.
Yes.
Honestly, in my opinion, it's very similar with compounding and preventative medicine. We're going back to the time when pharmacies were only compounding pharmacies.
I know, isn't that the history?
Yes.
Isn't the history of compounding pharmacies, that's how they started, right?
Yes. So it almost feels to me we're going back to the roots of where we started, where medications were made specifically for individual needs of particular patients. It was not mass production of one fits all. So right now, thank you that compounding pharmacy is back to where it used to be, where a doctor can prescribe specific medication particularly for that patient. And we as licensed pharmacists can put it together exactly as you prescribed it.
Right. And of course the standards that you set are incredible, because you're going to use sterile technique. You're going to comply with all the FDA, their protocols that they would require of you. You're going to comply with, whatever any legal entity and licensing agency is going to require. That's a given. I guess my thought process still is having difficulty in saying that the consumer is driving this demand,
right?
But yet there's not enough doctors educated to keep up with that. There's a disconnect.
Yes.
Can you help explain that?
So in my opinion, the disconnect really comes from the fact that traditional medicine really is there to treat serious disease states.
Meaning the acute.
Exactly.
Sometimes the acute, right? When you've got an issue, a serious acute issue, you got in an accident, or just the flu just hit you just like that, or whatever. Right?
Or even chronic, like hypertension, diabetes, cholesterol. So conventional medicine is there to really take care of the problem that people already have. But there is no medicine that is really there to prevent people from having those problems. Yeah. And this is where doctors like you come in and educate people and really present alternatives that are available there to have some kind of solutions and medications that will help the body to prevent having those disease states.
Yeah. or if they're imbalanced, to help bring a little bit more balance without
Right.
any side effects. Right?
So in my view, medical school teaches to treat disease states, but there is no school that really teaches for people to stop having those disease states.
Or to look at early imbalances and dysfunction. With that, I would add that we're trying to gain more recognition, and that's functional medicine. Look this up, functionalmedicine.org. There's also worldhealth.net. And these are organizations that have incorporated functional medicine. So a lot of what anti-aging and regenerative medicine is it requires the knowledge of functional medicine. It requires the knowledge of aesthetic medicine. Because, in compounding, I sometimes ask you guys, there's a lot of sometimes some of the aesthetic compounding medicines. Can you share that a little bit about what, sometimes doctors might ask you to fill, or what doctors might ask you to compound for them in terms of some of the aesthetics?
Absolutely. What's been very popular, and a lot of the spas and a lot of dermatological offices are requesting, is bleaching creams.
Yes.
Yes,
it's huge,
anti-aging creams, under eyes creams for thickening of the skin and to prevent thinning of the skin. Also, dark circles under the eyes.
What are you seeing? What are you seeing for dark circles under the eyes? A lot of the ingredients or compounding, some of the main things are.
Bad question.
Bad questions. Is it in terms of meaning in terms of some of the nutrients, like we use, like there's some herbs that you can use, and some of the like tyrosine inhibitors, which are very natural, that you can compound, help compound for us. And so that's been really a nice thing. It's so nice sometimes to be able to say, hey, make a nice salve that you can put after like a post laser, or like something that you can just compound that would help just calm the skin down.
Yes.
It's those things are just invaluable tools to have on hand.
Absolutely.
Sometimes I need something with like if a patient had just feeling that their face is very, very dry, or very irritated, then it's just not enough to go and get a 1% hydrocortisone, which has mineral oil in it.
Right.
I mean, why would I put hydrocortisone, which has some byproducts which are going to irritate further? So I call then the compounding pharmacy like you and say, can you do the 1% hydrocortisone and put these things in? And those things are all beneficial to help calm the skin down additionally.
And this exactly brings us to your first question. Why the growth of compounding pharmacies? And the reason why, because patients are asking for paraben-free, lactose-free, dye-free.
That's what's happening. We're seeing so many of these medicines. I'm going to give you an example of a medicine. So for allergies, you have a dairy allergy, right?
Right.
Generally, let's say people are allergic to dairy allergies, and then they get their allergies. A lot of them are prescribed Claritin.
Right.
Okay. Do you know that Claritin has a lactose binder? Okay. Can you explain me? Why would you put a lactose binder in a medicine that you are giving for an allergy, that the patient actually has an allergy to the dairy? Does that make sense? So that's when I call on you and say, Helen, please, this is not making sense to me, and so we can then try to say, okay, can we have, an antihistamine without the dye content, or without the lactose binder? Is there anything else that we could possibly use? Or we've got a patient that says, I'm vegan, entirely vegan. I need an entirely vegan capsule. Then we have to go back to you and say, okay, so it's a constant challenge. It's a very personalized interaction that we actually have developed.
We work incredibly close with our doctors.
Yeah, it's a tremendous. So these are just some of the examples. So and then sometimes there's an issue. Like, for example, I had a client still having foot pain, and I've been to like every doctor in the world, everything, and still having this tremendous foot pain. Well, we got to, I said, hey, do you think you could just help me compound this thing for me? And it turned out to be I think all we did was we did an anti-inflammatory, and we did a spasmodic or something. And we did it topically. It worked.
Yes.
And we put it in a delivery system that perhaps was able to deliver a little more readily through the skin, and it worked.
It does. It just works, and that's why there is a growth.
Yeah.
And one thing I would like to mention, you're a doctor, thinking from the doctor's point of view. I have a patient asking me why nystatin suspension has sugar in it.
Yes.
I can't explain it. I don't know how to explain it.
Do you see how educated the consumer is?
Incredibly educated.
Yeah.
Yes.
And why is it that so many of the other things that I see medicines that dies? How many people we're living in a very environmentally toxic world? So these are the kind of issues constantly I'm being hit with. I too get asked that. So this is the first thing I say. I can get this made in a way that perhaps you can avoid all of that. And I have to rely on compounding pharmacy, and I have to rely on a very good compounding pharmacy. I'll be honest, within a radius of where I am, there's about, I could choose probably 10 compounding pharmacies. I'm very selective.
Yes.
Okay? So it's your standards. Shall I tell you what was when I first, remember I said, I have to come and see your pharmacy. I have to have a tour.
I will
right?
never forget that.
Did I? It's like, no, Dr. Naina has to have. So, but when I came, what impressed me is that you did do your batch testing as required, and you did everything was just as it should be.
And I honestly wish we can speak to many other doctors who do use compounding pharmacies and make sure that everybody is doing third-party testing. Yes. It is absolutely vital. And
this is something that people don't realize, and then the compounding pharmacy gets the negative rap, and then credible people like you and I are affected, right? Because if we're not going to achieve the top, I say 5% standards, and that's what the show is about, setting those top 5% standards in the world, globally. I want this place and the guests that I bring into my show to be that top 5. I want them setting the standards so that when people watch, they will say, we've got those standards that we have to meet.
Absolutely, and that's exactly what we have. And I was incredibly proud. I didn't know what you're going to ask me and what you want to see in the pharmacy, but you walk in, and the first thing you ask, do you do third-party testing? And I said, yeah, they're right here. They're posted on our board. I
saw that. I still remember the board. It was to the left of me as I walked this way, right? Yeah, yeah. Again, thank you, so much for coming onto my show. How, for example, you have a wellness, I saw you have a lot of other wellness products, very nice wellness products. How do people find you? And let's say if the audience wants to, look you up, can you give us a website or a name of your pharmacy again?
Absolutely. So we're Great Earth Compounding Pharmacy. We're located on Santa Monica Boulevard. And you can visit us at www.greatearthpharmacy.com if you're looking for a quality compounding pharmacy.
Yeah.
Please.
How did you think of the name?
Well, the history is a little bit interesting because it started out from Great Earth Vitamins, which is natural, sort of herbal. Yes. So this is how Great Earth Pharmacy came.
That's very, very nice. And I had a lovely time meeting your mom.
Yes.
She's and she has taken care of herself.
Absolutely.
If you could tell the audience just that she walks the talk, does she not?
Yes.
Of having a woman who's taken care of herself, recognized that there was a need for her to go outside of her conventional realm of medicine, and she combined both, so to speak.
And this is again coming back to your original question, because I came out from pharmacy school. And my mom told me, she asked me, she said, Helen, there's somewhere they're making hormones, they're making something that it matches to your body. And I said, no, everything is pharmaceutically made, and are you talking about this or that? And she said, no. There is a pharmacy that makes the medications and they make hormones to match your body. And at that moment, I was not familiar with any of this. And my life led me to a path where I had to educate myself past pharmacy school and learn a lot more. And the reason why my mom can represent anti-aging, because she is representative of one of those patients who are looking and constantly searching for remedies to help themselves and to feel well and to stay youthful and anti-aging.
Yeah, it's a movement.
It is.
And it is going to gain so much. The consumers are going to demand that the doctors actually learn it, correct?
Right. And this is actually part of our promotional material, that if you don't provide it to the patient, your patient will find somebody who will provide this.
Yes, you're absolutely right. Thank you again.
I'd
love to bring you back on at another show. And again, it's Great Earth Compounding Pharmacy, one of the most quality pharmacies that I know around.
Thank you.
Thanks. We'll be back with my next guest.